Okay, so your surgery's over, you want to go home, and you want your patient to wake up, and you want to take them off the ventilator. So you can go ahead and turn your isoflurane off if that coincides with where you are in the procedure. And then as far as taking a patient off the ventilator, I'm going to go through the actual logistics steps of disconnecting and reconnecting things, and then we're going to talk a little bit about maybe some rough guidelines on how to wean them off. So taking them off the ventilator, you can hit the off button, and then the next thing I would recommend you do once you hit the off button is to open the pop-off valve here. And if you get into that habit of, okay, every time I turn the ventilator off, I open my pop-off valve, it tends to prevent us accidentally leaving it closed when we switch them. And so then what we're gonna do is we're gonna put our rebreathing bag right here. So when we set up the ventilator, this basically became our reservoir bag, and now we wanna take them off the ventilator. So I'm gonna grab another bag back here, and we're gonna put that back on this machine. And the way this machine is set up, it's basically a dual circuit scavenge, so you don't have to disconnect or reconnect any scavenge on the back of this machine. It's already set up to be scavenged whether you use this machine or this machine. And so basically now our patient is set up to spontaneously ventilate, and they're disconnected from the ventilator. So if you had a patient that was on the ventilator, for several minutes or an hour during surgery, and now you're trying to wake them up and get them breathing on their own, you basically need to turn on the respiratory center in their brainstem again. And to do that, we need to lighten their anesthetic plane and help them blow off some isoflurane. The only way you get rid of isoflurane, it's one of the few drugs we use in veterinary medicine, it's not metabolized by any organ system. It has to be exhaled out of the body to become a lighter plane of anesthesia. So to do that, what I would recommend is you can wait 60 seconds and see if the patient starts to breathe on their own. And some of them will, because they're right at that cusp of turning the respiratory center back on, but a lot of our patients are still too sleepy. They still have too much isoflurane in their brain to breathe on their own. So in that situation, I would give them 60 seconds to breathe on their own. If they haven't taken a breath, then I would give them 2 to 4 breaths a minute, so that you maintain their end tidal CO2 somewhere between, I'd say 35 and 45, but you could go up to 50 millimeters of mercury on your end tidal CO2. And so just ventilating them 2 to 4 breaths per minute then can be really helpful to maintaining their end tidal CO2. And remember, their end tidal CO2 is really reflective of their blood pH, and that's why we don't want their end tidal CO2 to get too high when we're weaning them from the ventilator. And usually within a few minutes, you'll recognize that patient's plane of anesthesia is getting a little bit lighter, they have a little bit of a palpebral, and then you'll notice that they'll start to breathe on their own. And that's basically how you disconnect the patient from the ventilator and how you would wean them off of the ventilator and start to spontaneously breathe again.